Well, hello everyone. It's Colorectal Cancer Awareness Month, and that means it's time to talk about getting those important preventative screenings done. And here to talk a little bit about what that is, it's Dr. Shannon Wesley of Lima Memorial Health System Surgical Specialist. Well, welcome, doctor.
Good morning.
All right. Well, first of all, can you tell us a little bit about colorectal cancer and who is at risk for it?
So when we start talking about colon and rectal cancer or colorectal cancer, we start talking about screenings and the ages of which we start screening. So the American Cancer Society did recently in medicine, I guess 3 years ago or so, change the screening age to 45. So we do start screening average risk patients at the age of 45. And then we start screening patients 10 years prior to the earliest family member that was diagnosed with colon cancer or colorectal cancer. So if your mom was 40, then you're going to go when you're 30.
All right. And then what kind of signs and symptoms should one be aware of with colorectal cancer?
So every time I'm on here, I always talk about the most important sign, and that is none. So if you're 45, definitely colonoscopy time. Even if you are not having symptoms, and I hear that almost every day, well, I'm 45, I'm doing great, or I'm 50, sometimes 60. We get them even into the 70s. I've never had a colonoscopy. I'm feeling wonderful. My bowels are regular. I don't have any belly pain. Just remember, the early stages of colon cancer typically do not have any symptoms. So when we start talking about colon cancer or colorectal cancer symptoms, we are talking about changes, and that is when your bowel habits start to change for you. We aren't talking about what the definition of normal is. When we Google it, we're talking about what normal is for you. So any change in your bowel habits, if you go every day, then you're not going every day, or you go every 3 to 4 days and then you start having diarrhea, and that's not normal. Those are changes, and those are changes that we need to watch for. And if you don't know what a normal is for you, then you need to start paying attention to what normal is. The other things we're going to be looking at are abdominal pain and any type of rectal bleeding are the biggest things, and no type of bleeding from your bottom is normal. And I always push that every time I'm here as well. If you have bleeding from your bottom, it is not normal, even if it's bright red. So let's focus on the fact that, it can be hemorrhoidal, but it's not always hemorrhoidal. And lower rectal cancers can produce bright red rectal bleeding. So we need to make sure it is in fact hemorrhoids, and it could be your hemorrhoids, but if it's not, that's a big oops.
Okay. And is there anything that can be done to prevent or treat colorectal cancer? Colorectal?
Yeah. So the biggest thing is, and I guess I should tell people that colon and rectal cancers are the same. The rectum is just the last part of the colon, and every section of the colon has a name. So we just say colorectal. It's all colon, all the same types of cancer, just every section of the colon has a name, and the last part of the colon is the rectum. So the cancer is actually the same. But the biggest way to prevent colon or rectal or colorectal cancer is to make sure that you're getting screened and that you're paying attention to your body. So if anything changed, just get looked at. We can talk through it. We can decide if a colonoscopy is the best route to go. But the easiest way to prevent colon cancer is to get screened. And then if we do a screening, or you are having symptoms and we find it, usually we can treat it if it's very early, and that's it. We remove it with a colonoscopy, or you may have to have a surgical procedure, and then that's how we cure it.
Right. So obviously the screenings are very important. Now, if someone is experiencing symptoms or just want to get a regular screening, who can they call?
They can call my office anytime. I'd be happy to talk to them, whether it's appropriate time for them to have a colonoscopy, if there's something else that we need to do. If they've already had a colonoscopy and they're concerned about their symptoms, we can surely make sure that it's just hemorrhoids or something else that's going on with their bottom.
All right. Well, Dr. Wesley, thank you so much for joining us today.
Thank you.
All right. Don't go away, because we have more when we return.